Hello, I'm Susan White, Certified Nurse Midwife. Let's talk about newborn vitamin K, the benefits, the risk, and the controversies. So vitamin K is very essential for our blood to clot. Now, in pregnancy, only a small amount of vitamin K crosses over to the baby. And also, they don't have the correct intestinal bacteria that will produce vitamin K later in their life. And then after birth, there's only a small amount of vitamin K in breast milk, and that's why babies are low in vitamin K. But what purpose does that serve that they have low vitamin K? According to Blackburn, it actually may be a normal mechanism to help control their growth, because the fetal growth and the newborn growth has to be just within a narrow range, and that newborn vitamin K being low might be important to help with normal growth. So it is indicated by, according to the American Academy of Pediatrics, for babies to get a shot of vitamin K within 6 hours of birth. For full-term babies, premature babies actually get a smaller dose. Full-term babies get 1 milligram. And that's to help prevent vitamin K deficiency bleeding that they're at risk for. Now, this one-time dose, and it's a shot into the muscle, that builds up their vitamin K stores to actually last for 6 months until they start taking in solid food. Let's look at vitamin K deficiency bleeding a little bit more so we can understand it better. So there's different types. There's an early onset vitamin K deficiency bleeding that starts in the first 24 hours of life. That's usually because of mom's medications that she has to take. Maybe if she's on seizure medications, medications for tuberculosis, and even certain antibiotics that can cause the baby to be at risk for this early type of vitamin K deficiency bleeding. And if the baby does not get their vitamin K shot, the risk is 6 to 12% in babies in that situation. And there's no evidence that if we increase mom's vitamin K, that can help prevent it. And then what can that cause with baby? They can have bruising all the way up to severe bleeding. They can have bleeding in their abdomen and even in their brain. Now let's look at the classic vitamin K deficiency bleeding. It's going to happen between 2 days of life and 1 week. Now the risk of a baby getting that if they did not get the vitamin K shot at birth is 0.4 to 1.7 per 100 births. So 1 to 2 babies out of 100 would have the risk of getting this vitamin K deficiency bleeding. And what symptoms could they have? They can have bruising, umbilical cord site bleeding, bleeding if they've had a circumcision, and even more serious bleeding from like their GI tract. Then there is a late onset vitamin K deficiency bleeding. This occurs between 1 week and 6 months of age, and they have found this mostly with babies that didn't get the vitamin K shot at birth and they are breastfed. And that risk, if the baby didn't get the vitamin K of the late onset type, is, you can see, 4.4 to 7.2 babies in 1,000 births. And so it is a rare situation as far as looking at the numbers. The problem is that the babies that do get it, it can be very serious. 30 to 60% have intracranial bleeding, so bleeding in the brain. They can have seizures, they can have developmental delay, they can have irreversible neurologic damage, and 20 to 50% of them actually can die. So even though it's not that common, it can be very serious. So let's look at some signs and symptoms of vitamin K deficiency bleeding. The baby can have bruising. They can have bleeding from their nose, mouth, there again, the umbilical cord. They can have blood in their urine. When they have a poopy diaper, there can be blood in there. Babies can be lethargic. They can not want to eat. They can have irregular breathing. They can be cold, have hypothermia. They can be fussy. They can end up having seizures, vomiting, and the soft spot called the fontanelles that the babies have, the soft spots can actually be bulging. And that intracranial bleeding there again is bleeding in the brain, and that can be hard to detect early with newborns. And so that's what's kind of scary. How do they treat vitamin K deficiency bleeding? Well, they have to treat it with vitamin K. In this case, they have to give it IV because the situation with the bleeding is so severe. They may have to even give blood products and medications for seizures, and the baby may even need surgery. Let's look at the risk of giving the vitamin K shot. IM stands for intramuscular. Let's look at some risk of the vitamin K shot. So there again, it's intramuscular, so it's a shot into the leg. They can have some mild irritation at that site. Of course, pain just from the needle stick. They can have bruising or swelling. A severe allergic reaction is actually very rare. There's only only been one case reported in all of the research. Now let's look at some of the reasons that parents refuse to have the vitamin K shot for their newborn. Let's look at this. Vitamin K increases the risk of childhood cancer. This has been promoted out there on the internet, this belief, and let's look at where that comes from. In 1992, there was a small study that found an association between leukemia and giving the vitamin K shots. However, it was a very small sample size from one location, so it was a small study. It was retrospective, which is not the greatest quality study. The other thing is the formulation they were using is different than the formulation that we use today. And then there's been numerous other studies to try to see if this is true, and they have not found any association between the shots of vitamin K and any type of childhood cancer or leukemia. So this has definitely been disproven. What about the belief that clotting normalizes on the 8th day of life? Well, actually, vitamin K deficiency bleeding does decline in incidence after that first week. However, babies are still at risk for bleeding until they start solids at 6 months of age, and especially exclusively breastfed babies are at higher risk than the formula-fed babies. Of course, parents are concerned about the pain of the injection, but there's some ways to decrease that pain. You can actually do the baby skin to skin, which normally vitamin K is given at the end of that first hour when mom and baby should still be skin to skin, and that's going to help decrease their pain. Also, breastfeeding, which we should be doing during that first hour as well, decreases pain during the shot. And then if for some reason you're not breastfeeding at that point, then we can use a sucrose pacifier, a pacifier with a little bit of sugar on it can also help decrease the pain of the injection. And then there is concern about the vitamin K dose being too high. So if we look back at the research, higher doses of vitamin K greater than 5 milligrams, that they were associated with higher risk of complications. And also there was an earlier version of vitamin K3, that they found to be toxic. They don't use that anymore. So the current version of vitamin K is K1, and the current dosing of 1 milligram or less is a lot lower dose than what had been researched. And with that current version of vitamin K and the current dosing, no adverse effects have been seen. And then there is concern about harmful other ingredients mixed in with the vitamin K, emulsifiers, buffers, preservatives. So the current vitamin K formulations have a lot less amounts of those than the amount that could cause toxicity. You can also ask for the preservative-free formulation of vitamin K at the facility where you're going to give birth. And then there is concern about the aluminum content. It is present in a very small trace amount, but guess what? One shot of the vitamin K has less aluminum than what a baby's going to get with breastfeeding or formula feeding in one day. So it's a very tiny amount. What about the black box warning that is on the box that the vitamin K comes in? It's talking about the risk of a severe allergic reaction called anaphylaxis. That is higher with IV administration. And in the research, the risk of the anaphylactic reaction with IV vitamin K is 3 in 10,000 doses. But remember, we're giving it we're giving it into the muscle with the shot for the baby. And we've only there again had one documented case of allergic reaction in a newborn. What about giving mom more vitamin K for pregnancy or breastfeeding? So what we found is if mom increases her vitamin K prenatally, it doesn't really increase the vitamin K in the newborn because it doesn't cross the placenta of very high amounts. And then also the same thing with the breastfeeding. If mom increases her vitamin K, it actually does increase the level of vitamin K going to the baby, but it's still not enough to prevent that vitamin K deficiency bleeding. So what about giving oral vitamin K? That's a good question. So oral vitamin K is used in Europe more over there as an alternative to the injection, to the shot. But they haven't agreed on the amount of dosing and frequency. If you look in the research, there's so many different articles, and they're still trying to figure out what is the best dose, how often do we give it, how long do we give it. And so because of that, there's also a concern with the parents being compliant with giving it properly. Because sometimes reports, they have recommended giving it like every day for weeks, for example. So that's hard to stick to. And then also, oral dosing, giving it by mouth, is just not as effective as the shot, especially for the late onset vitamin K deficiency bleeding. Also, about giving vitamin K by mouth, we don't have any oral vitamin K products in the U.S. that are FDA approved to prevent vitamin K deficiency bleeding. And then there's been reports some people have used the formulation that we're supposed to give as an IM injection. They've given it to the baby by mouth, but it has a really bad taste and the baby spits it out, so that doesn't work very well. Now, you can find some supplements to give orally, but we don't have research to really know the effectiveness of that or what that dose should be. So what are our final tips and takeaways? At this point in time, the vitamin K injection given into the muscle still provides the best protection against vitamin K deficiency bleeding. Many of the fears and concerns that parents have or that you find on the internet about vitamin K are really based on incorrect information. And as parents, you want correct and factual information, up-to-date information for you to make an informed decision and discuss with your provider. Speaking of which, a link to all of my references are in the description. If you'd like to learn about childbirth from a Christian perspective, please check out the links in my description. For Childbirth Education for the Christian Family, we have birth classes. We also have certification programs for birth doulas, postpartum doulas, and childbirth educators. Thanks.